If you have alcoholic hepatitis, you probably have a lot of questions about the condition and what you're going to face. So I went to Google to see some of the common questions to get a sense of what patients are asking that they may not even come to me with. And this is what I found. Our first question, why is prednisolone used to treat alcoholic hepatitis? The original study that demonstrated the effectiveness of treating alcoholic hepatitis with steroids specifically used prednisolone. As a result, prednisolone has become the standard for treating alcoholic hepatitis. However, prednisolone is not as readily available or affordable as prednisone. Prednisone is a very similar compound, another steroid, but it must be converted into its active form, prednisolone, by the liver. There is concern that when you have a sick liver, it may not be able to successfully convert prednisone to prednisolone, and for this reason, prednisolone continues to be used. But this concern is probably overblown. Perhaps patients with liver disease more slowly activate the drug, but then the drug may hang around longer and its net effect may be similar. A lot of this variability probably actually has to do with genetics. People just metabolize drugs differently. Another determinant of how effective a drug is how much protein is floating around the blood as a carrier of the drug. And when a person has liver disease, those proteins tend to be low. And that's a problem whether you have prednisolone or prednisone. Overall, there's no strong evidence that makes a convincing demonstration that prednisolone is much more effective than prednisone. I tend to prescribe prednisone because of the fact that it's more readily available, because what is certain not to work is a drug that a patient can't obtain. Our next question, can hepatitis be caused by alcoholism? When patients are asking this, they're usually surprised because they're thinking of viral hepatitis. And the names of hepatitis A, B, and C, these viruses, is confusing because it suggests that hepatitis is a virus. It's not. It's simply the phenomenon of the liver being inflamed. And that can be for any number of reasons, not just viruses, but also metabolic reasons, genetic reasons, autoimmune diseases, fatty liver, which can include causes of alcohol and non-alcoholic fatty liver disease. So there's a lot of reasons that a person gets hepatitis, and it's not simply viruses. Even if we're thinking of the viruses, they extend well beyond just the classics of hepatitis A, B, and C. So if you hear that you have hepatitis, don't assume that you have a viral hepatitis. And if you're told that you have alcoholic hepatitis, understand this simply means that your liver is inflamed because of overuse of alcohol. Question 3, does alcohol hepatitis cause diarrhea? Alcoholic hepatitis itself does not cause diarrhea, but overuse of alcohol definitely can cause diarrhea, and that's because some of the compounds within the alcohol are not readily absorbed. They can also irritate the bowel lining, and that results in stuff not being able to get in, must come out the other side, causing diarrhea. Question 4, does alcoholic hepatitis cause hair loss? So we can take this question in a couple of directions. If we're talking about hair on top of our head, then no, alcoholic hepatitis does not cause loss of hair on your head. People may find that their hair falls out around the time of having alcoholic hepatitis, but this is because they had a serious medical condition, their hair stopped growing, and then in the future when it starts to regrow, those new shoots push the old hair out, and this causes the phenomenon of it appearing to be that you're shedding all of your hair at once, when in fact, it was a prior event that stopped your hair growing, and now as your hair regrows, it sheds. On the other hand, hair that is on your legs, arms, or chest can change because of the hormonal changes that come with chronic liver disease. And this pushes people to a more estrogen-heavy hormone balance, and so men might see that they have less hair on those areas that they were used to having hair, which means they might have less back hair. For our final question, does alcoholic hepatitis lead to cirrhosis? Yes, it can, but alcoholic hepatitis and alcoholic cirrhosis are in fact different. Alcoholic hepatitis is the acute problem. It's caused by inflammation. Alcoholic cirrhosis is scar. Now, in the immediate hospital setting, they're almost indistinguishable from one another. Person can look yellow, their belly can be swollen, and they can have some other complications of chronic liver disease like confusion, even when they present with alcoholic hepatitis. It tends to be that if they have more of those problems, then they're more likely going to prove to have cirrhosis, but ultimately it takes time to know that for certain. There's some labs that might also hint towards the chronicity of their disease, but ultimately it can take 6 months or even a year to see how that inflammation is going to subside through abstinence from alcohol, because the ultimate story might be that it improves greatly, but it could also be that there's already a lot of scar present, or that all that inflammation is going to resolve into the chronic scarred condition of alcoholic cirrhosis. I hope we've answered some of your questions on alcoholic hepatitis. Please explore the channel because we have a lot more content on alcoholic hepatitis, including its diagnosis and prognosis. Thank you and be safe.